Okay, today we are going to talk about mammary gland. Let's know few important points about this most important structure. This is a modified sweat gland present in the superficial fascia of the pectoral region. So we should know what is tail of Spence and foramen of Langer. The gland is divided into four quadrants: upper, lateral and medial, lower, lateral and medial. The upper lateral quadrant has a small extension called the axillary tail of Spence, and this extension passes through an opening in the deep fascia called foramen of Langer. Now, what are the structures which forms the bed for the mammary gland? So we know the mammary gland lies over the pectoral fascia. What is pectoral fascia? The fascia covering the pectoralis major muscle, and we know the pectoralis major takes origin from the anterior surface of clavicle. So that is anterior surface of clavicle. You can see the inferior surface has a groove which gives attachment to a small muscle called subclavius. The muscle just beneath the pectoralis major is pectoralis minor. So now a fascia extends from the clavicle to the pectoralis muscle is called clavipectoral fascia. This fascia splits above to enclose the subclavius muscle, descends down, again splits to enclose pectoralis minor, and moves laterally to merge with the axillary sheath. So what we should know about clavipectoral fascia? The structures piercing this fascia. We have four structures: artery, vein, nerve, lymphatics. Artery is thoracoacromial artery, vein cephalic vein, nerve is lateral pectoral nerve, and lymphatics from the breast, which drains into the apical group of axillary nodes. This structure pierces the clavipectoral fascia. So the structures, that is the deeper relations or the bed structures, are mainly the pectoralis major muscle, which takes origin from clavicle, sternum, inserts into the humerus. What other muscle which forms the bed for the mammary gland? So we have a muscle from the anterior abdominal wall called external oblique abdominis, and few digitations of serratus anterior. Yes, so these are the three muscles which forms the deeper relation of mammary gland. Now let's talk about the structure of mammary gland, which is very simple. Just remember skin, parenchyma and stroma. So this forms the structure of mammary gland. What about the skin? It has a small conical projection called nipple, and this nipple is pierced by 15 to 20 lactiferous ducts, which is rich in nerve supply and has many sensory end organs at the termination of nerve fibers. So what is the structure surrounding the nipple? The pigmented circular area is called areola, which contains modified sebaceous glands which becomes raised tubercles of Montgomery during pregnancy and lactation. That's all about the skin. Moving on to the parenchyma. So only thing we have to remember under parenchyma is glands. Parenchyma is nothing but glands. Mammary gland contains 15 to 20 lobes. Each lobe contains a specialized tubulo-alveolar glands, and you can see before the duct opens into the nipple, it forms a small dilatation called lactiferous sinus. So what about the lining epithelium of this tubulo-alveolar glands? They are normally lined by cuboidal epithelium, that is at rest. During lactation, this cuboidal epithelium becomes columnar, so what happens during lactation? The milk secretion from the tubulo-alveolar glands reaches the lactiferous ducts during sucking. So what facilitates this movement is the specialized myoepitheliocytes. These myoepithelial cells are found between the epithelium and the basement membrane. So that is the acini lined by columnar cells, and we can see this myoepitheliocytes between the epithelium and the basement membrane. And moving on to stroma. So nothing much to talk under stroma. It has fibrous and fatty part. The fibrous stroma forms septa, which anchors the skin and the gland to the pectoral fascia, which is called suspensory ligament of Cooper. So moving on to the blood supply of mammary gland. So this gland is extremely vascular. Blood supply is very simple. So we have to just remember two major arteries. The subclavian artery and the axillary artery. So from the first part we have internal thoracic artery from the subclavian artery, which gives few perforating branches to supply the mammary gland. And the axillary artery, we already know it is divided into three parts by pectoralis minor. From the first part we have superior thoracic artery, and from the second part the gland is supplied by lateral thoracic artery, and this second part has one more branch called thoracoacromial artery. And apart from these two major arteries, the gland receives blood supply from posterior intercostal arteries. So this is about the arterial supply of mammary gland. Moving on to the venous drainage, it is simple. So the veins just follow these arteries. Before going to the venous drainage, again, what are the arteries? They are internal thoracic artery from subclavian artery, superior thoracic, lateral thoracic, acromiothoracic, which are the branches of axillary artery, and posterior intercostal arteries. Now the corresponding veins are again internal thoracic vein, superior thoracic vein, lateral thoracic vein, acromiothoracic vein, and posterior intercostal veins. These veins, they move towards the base of the nipple to form anastomotic venous circle. Generally, the venous drainage is divided into superficial set and deep venous sets. The superficial vein drains into the internal thoracic vein, whereas the deep vein drains into the axillary and posterior intercostal veins. Now moving on to the lymphatic drainage of mammary gland, which is very important surgically. So generally the lymph nodes are divided into axillary group, internal mammary group, supraclavicular, subdiaphragmatic, deltopectoral nodes. So here, what are the axillary group of lymph nodes? Near the anterior axillary fold is anterior axillary lymph nodes. In the posterior fold, posterior axillary lymph nodes. Laterally, we have lateral group of axillary lymph nodes. Then central group, that is apical group. And just above the clavicle, we have supraclavicular group of lymph nodes. In the midline, there is internal mammary nodes or parasternal nodes. Beneath the diaphragm, we have subdiaphragmatic and subperitoneal group of lymph nodes. We should know the superficial, we have two lymphatics, superficial and deep lymphatics. The superficial lymphatics drains the skin over the breast except nipple and areola, whereas the deep lymphatics drain the parenchyma along with the nipple and areola. So here we should know the lymph from the breast drains about 75% into axillary group of lymph nodes and 20% into internal mammary group of lymph nodes, remaining 5% into posterior intercostal nodes. And it forms a plexus of lymph vessel just beneath the areola called subareolar plexus of Sappi. So this is all about the anatomy of mammary gland. In the next video, let's see how this anatomy is intermined in case of breast carcinoma, the most common pathogenesis.